Are you going to be?
Yeah.
Are you going to be?
Good evening, everyone, and thank you for joining us. I'm Sue Ellison, Communications Business Partner for People at Wiltshire Council, and really pleased to meet everyone this evening. Next slide, please. If you need to use closed captions or subtitles, please click on the CC button, which you can find at the bottom corner of your screen. This will turn on closed captions subtitles for the speaker's words. You can also change the caption language by selecting Settings, Caption Subtitles, and choosing the language you want. Please be aware this function is not available, unfortunately, on the Teams app for mobile devices. Okay, on with the webinar. Next slide, please. We are really pleased to have you here this evening, and in this session we'll give you a quick overview of who we are and what we do, how you can understand, explore and prepare for contacting adult social care, the support we offer across Wiltshire, how we help keep people safe and independent, including through technology-enabled care, and how we support young people moving from children's to adult services. You can add any questions in the chat during the presentation. Please remember to keep them brief and to avoid personal details. We will answer questions later in the webinar. We've had quite a few questions come in when people have signed up, so we'll answer those, but please feel free to share any further questions. I will now pass on to Councillor Gordon King, Cabinet Member for Adult Social Care at Wiltshire Council. Thank you. And next slide, please.
Good evening, everyone. I'm Councillor Gordon King, and I'm the Cabinet Member for Adult Social Care, and I'm delighted to join you this evening. In September, we held 4 roadshows across in Wiltshire. These gave us a valuable opportunity to hear directly from residents, carers and professionals about what matters to them most. Adult social care touches the lives of so many people in our communities, and it's vital that we continue to work together to improve our services and our support. Today is about sharing information and also about listening, learning, and making sure that every voice is heard. Thank you for joining us. I will now pass on to the Corporate Director, Care and Wellbeing, Emma Legg, to say a few words. Thank you.
Thank you, Gordon, and good evening. And like Gordon, I very much enjoyed meeting people across Wiltshire over the past few weeks to hear about your experiences of adult social care and really importantly, to find out what we can do better. So we were assessed by the Care Quality Commission last year, and in January we received the rating of good, which I am so incredibly proud of due to all the hard work that our teams do every day. But we know that we need to continue to improve and develop, and a big part of that journey is hearing from you and people who use services and who may need us in the future. So I really wanted to thank you for joining us tonight, and for those who might see this recording later, and for giving up your time and for sharing your feedback and your questions. So on to the main body of the webinar, and I'll pass you over to my colleague Emma Townsend, who is our Interim Director for Adult Social Care.
Hello everyone, my name's Emma Townsend. I want to start by thanking you for joining us this evening. Firstly, I want to give a brief overview of what adult care is. So we work with adults aged 18 and over who have a broad range of physical or mental health conditions, disabilities or other illnesses, to enable them to live their lives and do the things that are really important to them as independently and as safely as possible. The type of support we can provide could include assistance with daily living tasks, with personal care like washing and dressing, support to stay active in the community, and support with your home and with finances. So the care we provide could be short term, which might focus on helping you regain your independence, or it could be long term and ongoing. Next slide, please. When you first contact us, we'll ask questions about why you're contacting us to try to identify the best service and support for you. We might be able to resolve your issue straight away, or even order a piece of equipment for you there and then on the phone. However, you might find yourself needing an assessment from us. We always try to respond to requests as quickly as we can. However, there may sometimes be a wait. We've worked with a group of people who currently use our services to understand what that feels like and to create a resource called the Understand, Explore and Prepare Guide. This is a guide about what to expect when you contact us, what support is available, and it will help you navigate what can seem to be a complex process with lots of unfamiliar language and concepts. Next slide, please. The guide describes some of our different teams and services. It helps you understand what different types of assessment we do and how to prepare for a visit. It provides some prompt questions to think about in advance of a visit by us and explains why we would be asking you those questions. It includes a tool within it to help with that preparation, with space for you to make notes. It also provides links to different support in the community that you can access yourself. Social care is different from the NHS, and the guide explains why we would be asking about your finances. Most people do have to make a financial contribution to the care they receive, and there's information included about this financial assessment process. At the end, there are some frequently asked questions too to help. Next slide, please. We know that there are many people in Wiltshire caring for family members or friends, and we worked with some of these carers to develop the support services that are currently available. We now have a group of voluntary organisations working together to provide carers with advice, social activities and support to help them stay independent, healthy and connected to their communities. This organisation also completes carers assessments on our behalf, identifying their needs for support and then working with us to meet those needs. We understand that many carers do want to continue caring for as long as they can, but need support. We can look at different respite options to give them a break. If more formal support is required, we have a range of external support options, like home help, that can be provided for the person that's being cared for. I'll now pass you on to our next speaker, Margaret Louvu, Head of Service for Safeguarding and Prevention. Next slide, please.
So thank you for being here today. My name is Margaret Nglob. I'm the Head of Service for Safeguarding and Prevention, and I'm really delighted to share how we're working to support individuals and communities through timely advice, safeguarding and proactive wellbeing support. Next slide, please. So at the heart of our approach in our advice and contact team is often the first point of call for adults making contact with us or individuals seeking help and guidance. This team provides timely, accurate information and advice and play a very crucial role in signposting people to the right services, whether that's voluntary services, community groups, or health services. This work ensures that people are connected and they get the support they need and when they need it most, helping people to prevent issues from escalating and empowering individuals to make informed decisions, which is really important to the work that we do. When safeguarding concerns arise, our multi-agency safeguarding hub, which is MARSH, steps in there's a dedicated team that brings together investigation managers, police, and health professionals to ensure a swift, coordinated response. They work collaboratively and are able to assess risk more effectively and share vital information quickly and in a timely way. And the actions that they take ensure that we're protecting vulnerable individuals. It's a model that strengthens our safeguarding efforts and ensures that no one falls through the cracks, which is really important for us to ensure that this is the way that we approach this. Our prevention and wellbeing team focuses on early intervention. They work proactively with individuals and communities to promote independence, resilience, and wellbeing. And this is where they're helping someone to reconnect with their community, assess support networks, or build the confidence to live independently. This team is all about creating positive, strength-based, sustainable outcomes before issues become a crisis. Next slide, please. So what's new to adult social care is our tech-enabled service. When we talk about tech, we refer to the use of digital devices and systems that support people in their own homes and communities. It's not just about the gadgets, but it's about empowering individuals to live the lives they want with greater independence and confidence. Callum, we cannot see the slides. Okay, I think it's the next slide, please. Thank you. Tech can make a real tangible difference in people's lives, and here are just a few ways in which this helps. So it helps people stay safe. From fall detectors to emergency alarms, tech can alert carers or emergency services when someone needs the help. Provides reminders for people living with dementia. Devices can prompt individuals to take medication, attend appointments, or complete daily tasks supporting with memory and routine. And this helps with an individual having a structured routine to their daily living routines. Tech can also help monitor health and well-being. We've got wearable devices and sensors that can track vital signs and alert professionals to changes that may indicate when someone needs the support. It also supports tackling loneliness, and this could be done via video calling, digital companionship tools that help people stay socially connected, especially for those who may be in isolation or feel isolated. And lastly, it keeps people in touch with family and friends. And this is a simple use of communication tools that allow people to maintain relationship and for them to feel part of the community. Next slide, please. So what you can see in front of you are a few gadgets that we have in place that supports people to be able to live independently in the community. And this was really important that we share this product and you know, highlight how we are helping people live more independently, safely and confidently in their own homes. These devices are designed to support daily living, manage risks and provide peace of mind for individuals and their families. And why do these products matter? Together with these tools, we provide and create a safe and more supportive environment for individuals, especially those with long-term conditions, for instance, dementia and mobility changes. They also offer some reassurance to family members and carers, knowing that the help is available and the risk can be actively managed. I'll pass on to my colleague Caroline Bowen, who's our head of Whole Life Pathway. Next slide, please.
Thank you, everyone. Thank you, Margaret, and good evening, everyone. My name is Caroline Bowen, and I'm head of Whole Life Pathway. I'm so pleased that so many of you could make it here this evening. Just to explain a little bit about Whole Life Pathway. Whole Life Pathway is a service that supports people with mental health, learning disabilities, and or autism. This evening, I'm going to talk about the transition from children's to adult services. Next slide, please. Thank you. So in the recent Care Quality Commission report, it says in Wiltshire that young people and their carers reported that their experience of transition from children's to adult services was improving, which is really good news for us because we have been actively working to enhance the continuity and the quality of care during this really critical period. And I'd really like to explain how we're doing this. So teams from different services across adult care are meeting regularly to plan support for young people moving into adult services. These meetings provide a consistent and a coordinated approach for all young people transitioning into adults, ensuring timely, proactive support and reducing the risk of service gaps or cliff edges. So this joined up approach helps make transitions smoother and avoids those gaps in care. We've also strengthened links between our health services and adult social care. This approach promotes shared understanding, coordinated planning, and improved outcomes for young people and for their families. We're working with people who've been through transitions to help shape the services that truly reflect their needs. We are making sure that their voices are part of group conversations and day-to-day planning, so the services we offer are shaped by the people who use them. They stay person-centered and we meet all our responsibilities. We've also created a transitions passport to help young people and families plan their move into adult services with clarity and with confidence. Can I have the next slide, please? Where do we want to go? We want to ensure in Wiltshire that every young person experiences a smooth, supported and empowering transition into adulthood, where services are co-produced, they're person-centered, and they are shaped by the voices of those with lived experience. Through strong multi-agency collaboration, we aim to remove barriers, reduce inequalities, and create pathways that promote the independence, the well-being, and meaningful life opportunities for young people in Wiltshire. Our goal is to shift the focus from being reactive to being proactive and using preventative approaches that build resilience and independence. We aim to equip young people with the skills, confidence, and opportunities they need to thrive in adulthood through early planning, access to meaningful enablement, and employment pathways. Thank you. I'm now going to pass you back to Sue for the questions and answer session. Thank you.
Great, thanks everyone. We are now going to discuss some of the questions that have been sent in. If you want to post a question in the chat, please keep it as brief as you can and remember to avoid adding any personal details. We will try and answer as many as possible. Okay, thank you. So one of the first questions that we had in earlier before the webinar, this is a question for Emma Townsend. How do you intend to remedy the problem of there being insufficient social workers at Wiltshire Council? Unpaid carers are disproportionately affected by this problem. An irony when they themselves save Wiltshire Council so much money and should be being supported as a priority. Emma, are you happy to answer this question?
Thank you, Sue. Yes, we really do value and support unpaid carers. As I discussed as part of the presentation, that support is provided by an organisation called Carers Together. That's a group of voluntary organisations working together across Wiltshire. They offer advice, information and signposting, and they undertake carers assessments on our behalf and review support plans. So unpaid carers aren't typically waiting for a social worker in order for them to access a whole range of support. We've made that available to them. However, to address the part of the question about social work recruitment, we have a number of different strategies to ensure we're filling any vacancies we have. We offer student placements, we have an apprenticeship programme, for example, and we offer good learning and development opportunities for staff to encourage people to stay and develop into our more experienced workforce. Thank you, Sue.
Thank you, Emma. We've had another question come in. At Salisbury Food Bank, we support many vulnerable adults, many with mental health needs. It sometimes feels like they have fallen through the cracks of the social care system, which has led them to needing a food bank, or their perceived needs are below adult social care thresholds. Having a clear idea of support services will be hugely beneficial to myself and our volunteers. Caroline, could you answer this question? Thank you.
Yes, sure. Oops, sorry, I'm just getting my screen. Yes, thank you. Thank you for that question. So we recognise that many vulnerable adults, particularly those with mental health needs, may not meet the threshold or the formal threshold for adult social care under the Care Act, yet still face significant challenges in daily life. So we work with our partners like the NHS to ensure that people don't fall through those cracks. While some individuals may not qualify for funded care packages, there are a range of other community-based services available. So, in Salisbury, there are mental health drop-in centres like Riverside Sanctuary and peer support through Wiltshire Mind. And we'd be really happy to share a resource pack to your volunteers of the support services that are available in the area. Thank you, Sue.
Great. Thank you, Caroline. So we've had another question, which reads, do you need a referral from a doctor? And if you are entitled to a carer, do you have to become an employer in order to pay their national insurance, etc.? Margaret, could you answer this question? Thank you.
Thanks, Sue. So the quick answer to that question is no, you do not need to wait for a doctor to make a referral. You can refer yourself and someone you care for. You can also get in touch with our advice and contact, which already alluded to this being our front door. You do not need to wait for the GP or anyone else to refer you. I think the next bit to this question was if you're entitled to a carer, do you need to become the employee? It depends on how the care is set up. So if you arrange a carer for you through an agency, then you're not the employee. You're not the employer. So the agency handles all the paperwork like contracts and national insurance. But if you get direct payment, so this is basically money from the council to arrange your own care, you can choose someone or hire someone that you feel is the right person to support you. And then in that circumstance, you become the employer. That means that you're responsible for things like paying for their wages and supporting and sorting out tax NI. And the good news is that there's support available to help you manage all of this. So would be able to talk you through the processes and be able to advise on what you're needing to do. Thank you.
Great. Thank you, Margaret. And we've got another question for you, Margaret. So this is someone that couldn't attend the webinar and they no longer have parents with care needs, but their comment is how neglected self-funders are when it comes to support navigate services. Everyone should be supported during the stressful time of arranging care for loved ones, but there is nothing from social services unless you need funding. Fortunately for me, I had knowledge from working in the NHS. Could you answer that one, please, Margaret? Thank you.
Thank you, Sue. So thank you for that question and for the person who's shared the experience. I think we also want to be very clear that everyone is entitled to a character assessment regardless their financial status. We can also support with information, guidance and signposting if that's what's needed. Again, our advice and contact team can provide accessible information about the assessment process and about care options, providers that are available that we work with, and also what the processes are. We've also have information on our website with a lot of resources and information, and this is also available on Wiltshire adult social care support guidance that we can provide a link to. Thank you.
Great, thanks, Margaret. So we've got another question. What opportunities, services are available for people with profound and multiple learning disabilities that are available in Wiltshire? And this is one for Caroline.
Thank you, Sue, and thank you for that question. So Wiltshire Council offers a range of services for people with profound and multiple learning disabilities in Wiltshire. And these can include a direct payment, support in your own home, respite care, and day opportunities. Our learning disability and autism team work closely with our health colleagues and our providers to ensure that individuals with complex needs receive coordinated, person-centered support that promotes independence, well-being, and inclusion in their communities. Thank you, Sue.
Great, thank you. So another question, and Caroline, this is another one for you. Saying, where in Wiltshire, north of Trowbridge, are there places for severely disabled young adults to live independently from their parents, alongside other young people and a team of carers? We're at the start of this process and would like to start looking at what the future might look like. And Caroline, if you can take that one.
Thank you, Sue, and thank you for that question. You are at a really important and exciting stage, and there are several supported living options in the Trowbridge area and across Wiltshire that cater to young adults with severe disabilities who want to live more independently with the right support. You can contact our advice and contact team who will be able to support or signpost you to the right information. Thank you, Sue.
Lovely, thanks. And here's another question, Margaret, if you can take this one. It's a very short question. Can I have information about care at home and residential care for older people? Thanks, Margaret.
Thanks, Sue. So absolutely, yes. We offer a range of care options for older adults, and it's whether they prefer to stay at home or need more support. Care at home includes short-term help after hospital stays, for example. We've got a dedicated Wiltshire Support at Home team that supports with that care element. We've also got emergency response through telecare, and we've also got a recovery support from our reablement team. And for those who are needing more intensive care or long-term care, we've got options that can be explored through residential care, as well as nursing care, nursing homes care that cater for more complex medical needs. I think I also need to highlight that we do have extra care housing options for independent living with on-site support and sheltered housing for those needing minimal help. And this is available through our Wiltshire for Homes support, which is housing. And also you can access all of this information through our Advice on Social Care website. We'll be able to provide a link to where all this information is. Thank you.
Great, thanks, Margaret. And I would say to everyone, please do feel free to put any questions in the chat. We have got a few more to go through, but do feel free to add some. Thank you. So another question. As I get older, I have concerns for how my adult child with a learning disability will cope. What help is there to help us prepare for when I can't support them anymore? Caroline, can you answer this one? Thank you.
Of course, thank you, Sue, and thank you for your question. And just to say that you're not alone in feeling this way, and there is support available in Wiltshire to help you plan ahead. So Wiltshire Council has teams like the Learning Disability and Autism Service, and the health team, the community team for people with learning disabilities. They can help with care planning, daily support, and connecting you to the health and social care professionals that you may need. If your child ever needs help or is in crisis, the Wiltshire Intensive Support Service can step in to provide urgent support and to help them stay safe at home. Carer Support Wiltshire and the Wiltshire Parent Carer Council are great places to get emotional support, advice, and help with planning for the future. They're also helpful tools and guides like those from Together Matters that walk you through how to plan for emergencies, future care, and transitions. And don't forget about annual health checks and hospital passports, which help make sure that your child's health needs are understood and met. Thank you, Sue.
Great, thanks, Caroline. So another question, Margaret, if you're able to answer this one. I'm a carer and my partner has dementia. How do I get help to care for them now their needs are increasing?
Thanks, Sue. So carers for people with dementia can access a range of support services. Alzheimer's Support Wiltshire offers dementia advice. We also have day clubs, home support, and there's training available for carers. Carers Support Wiltshire provides carers assessment, respite options, emotional support, and help with benefits. You can also contact Adult Social Care for formal assessment of care, and this also helps with you supporting for you're cared for. Respite is also available via day centres, home care, short stays, and financial help may also include carers allowance, attendance allowance, and services that aim to support your partners or identify increasing needs and how you can be supported to also manage your well-being as a carer. Thank you.
Great, thank you very much. So another question that's come in is, how does prevention and wellbeing show in persons already in the social care system? Currently, it still feels very much like it's more firefighting. And Margaret, if you can answer this question, thank you.
Thanks, Sue, and thank you for the question. I think we acknowledge and recognise that we understand that sometimes it feels like support only arrives when things get really difficult, but we are trying to work to change that. Our prevention wellbeing is about helping you live every day, not just stepping in during the crisis. This includes, for example, helping you to stay active, connected in your community, and make sure that you're accessing the things that support your health and independence. For instance, social groups, hot meals, or help at home. We're also working closely with other services like housing, health, community organisation to offer support that is local to you. It's a journey, and we know there's more to do, but we're committed to making our support more about living well and not just managing emergencies. Thank you.
Great, thank you. And then another question. How much control does Wiltshire Council have as a local authority regarding the care that people receive in their homes? And Emma, if you can answer this one, thank you.
Thank you. Our control over home care is shaped by some limitations. So legally, we must follow the Care Act 2014. We cannot provide health-related services, which are the responsibility of the NHS. And financially, we must balance individual preferences with cost effectiveness. So sometimes offering people a personal budget that can meet their needs instead of a preferred but more expensive care option. And most of our services are delivered by our external providers. So while we have clear standards and we do monitor the quality of that support, unfortunately, we don't have that day-to-day control over the care. Service availability also depends on market capacity, and delays can occur if providers are understaffed. But we work really closely with our providers, and we can provide support and advice and guidance where they need it. Additionally, individuals can use direct payment, so they then have more autonomy, more choice and control over the care and support they get. But that does reduce our direct influence over how care is arranged. But for many people, that's what they need, and that gives them the control and the choice they require. Thanks, Sue.
Great. Thank you, Emma. So we've had a question come in. this one, if Margaret, if you're happy to answer this one, how can we find out more about information of the uses, functionalities and costs of digital devices and how to request them?
Thanks, Sue. So there's a lot of information on digital devices and a large range of devices on the market. We do have an independent living centre in Semmington that supports people who want to fund their own equipment through an occupational therapy assessment and recommendations on suitable products. And if an assessment from social care is required, this can include advice on the range of products and services through social care. Then a referral can be made to social care, and the link is on our website. And I think new to adult social care, we now have a dedicated tech team who, who will be able to support with information and advice in a timely way. Thank you.
Great. Thank you very much, Margaret. I think that's pretty much all the questions that we've had this evening. And thanks everyone for the varied questions. We will now start wrapping up this webinar. We will be sharing the questions and answers we have answered, as well as those any additional ones we may have, as an FAQ page on the Your Care, Your Support web pages. So please do visit there in the next few days. You will notice as we've been talking, there's been some links put in the chat. So please do have a look at those links as well. And as we say, this recording will be available for you to watch afterwards and to be shared. Next slide, please. So thank you again, everyone, for joining us this evening and for taking time from your evening to share your thoughts and questions with us. Enjoy the rest of your evening and thank you very much.